Hello, my name is Matthew Diehl.
And I'm Nick Smithmyer. We are brothers of the professional pharmacy fraternity Phi Delta Chi Beta Gamma chapter at the Milan School of Pharmacy, Duquesne University in Pittsburgh, PA.
In today's episode of Know Your Drug, we'll be discussing Plavix, also known as Clopidogrel. Plavix is commonly prescribed for the prevention of heart attacks, strokes, and blood clots. It is used many times after a patient experiences a heart attack, as well as unstable angina or chest pain. This set of symptoms is known as acute coronary syndrome. Today we'll be highlighting the importance of using Plavix in the treatment of these heart conditions. Plavix is a member of the class of drugs known as the thienopyridines, which inhibit the aggregation or clumping of platelets, which form hazardous clots in the body. Other drugs in the same class include Ticlid and Effiant. These drugs all vary in some degree, such as strength, potency, dosing, and also duration of action. However, Plavix has been shown to have the least severe GI side effects compared to Ticlid. There are a variety of chemicals and factors which affect the ability of the body to form blood clots. Platelets are the components of blood that are responsible for this biological function of clotting. Plavix prevents this clotting by inhibiting certain chemicals that help to cross-link platelets and thus prevent the platelets from forming an organized network, which would later become a thrombosis or a blood clot.
Plavix is most commonly taken as a 75 milligram dose taken once daily with or without food at the same time each day with a full glass of water. For those who are at high risk of heart attack due to congestive heart failure or coronary artery disease, Plavix should be taken with low-dose aspirin, but only after the consultation with a physician. When first starting Plavix, it is important to maintain your follow-up visits with your physician to ensure drug effectiveness without serious side effects. These visits may include liver function tests, since Plavix undergoes extensive liver metabolism. In fact, the metabolite or product of liver metabolism is the component of Plavix that is active in the body. Another laboratory test that should be performed routinely is a CBC or complete blood test, which analyzes all the components of the blood, including red blood cells, platelets, and white blood cells. While taking Plavix, it is important to be aware of the potential for bleeding, which is a sign of a major health risk associated with Plavix. Bleeding may occur in the GI tract and would manifest itself in the stool. If you experience this serious side effect, speak to your physician immediately. Other minor side effects include abdominal pain, diarrhea, and nausea. If you miss a dose of Plavix, take the missed dose as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the medicine at your next regularly scheduled time. Do not take extra medicine to make up for the missed dose.
Some potential drug interactions to be mindful of when taking Plavix include the concurrent taking of NSAIDs, which include over-the-counter and prescription drugs such as Aleve, known as naproxen, and Motrin, known as ibuprofen. Plavix should not be used with other anticoagulants such as Coumadin, also known as warfarin, as well as heparin. An herbal supplement known as ginkgo biloba has antiplatelet effects, so it generally should not be used in conjunction with Plavix. Notify your doctor or pharmacist of any prescription, herbal, or other OTC medications you take to ensure there are no serious interactions with your medications. When used appropriately, Plavix has been proven effective in preventing cardiac events as a result of the inhibition of the clotting function, especially in those at risk for such events due to heart disease or blood vessel diseases.
Always remember, pharmacists are the drug experts. Utilize them to ensure you are receiving the best pharmaceutical care possible and to know your drug.
On behalf of Phi Delta Chi and Duquesne University's Milan School of Pharmacy, my name is Matthew Diehl.
And I'm Nick Smithmyer, and this has been Know Your Drug.